Top 4 Best Vitamins. Every diabetic must take. Lower blood sugar. Health Aura. Know it right. Live it light. What if the secret to feeling more energized, balanced, and in control of your blood sugar was as simple as giving your body the right nutrients? Many people with diabetes do everything by the book. Watch their carbs, stay active, take medications, yet still struggle with stubborn symptoms like fatigue or nerve discomfort. Could missing just a few key vitamins be the hidden link? In today's video, we'll uncover 4 essential vitamins that can help you regain energy, support nerve health, and steady your blood sugar. Ready to discover what your body truly needs? 1. Benfotiamine. The hidden key to restoring nerve health and protecting your body from diabetes damage. Have you ever wondered why, even after carefully managing your blood sugar, symptoms like burning feet, numb toes, or slow-healing wounds still creep in? You do everything right. Watch your diet, stay active, take your medications. Yet something beneath the surface continues to erode your nerve health and vitality. The truth is, high blood sugar silently unleashes a cascade of harmful byproducts inside your body. Over time, these toxins stiffen tissues, inflame nerves, and gradually damage delicate organs, especially in places with tiny blood vessels like your fingers, toes, eyes, and kidneys. But what if there were a way to gently shift that inner chemistry, to reroute sugar down a safer path, to shield your cells and give your nerves a chance to heal? This is where benfotiamine comes in, a powerful, fat-soluble form of vitamin B1 that offers protection far beyond what regular thiamine can do. Unlike standard B1, which dissolves in water and struggles to penetrate cells, benfotiamine effortlessly enters your tissues, reaching the places that need it most. Once inside, it helps divert excess sugar through a healthier chemical pathway called the pentose phosphate pathway. This simple shift reduces the formation of advanced glycation end products, AGEs, those sticky, toxic molecules that form when sugar binds to proteins, causing stiffness, nerve pain, poor circulation, and organ damage. AGEs are now recognized as one of the major culprits behind diabetic complications. In numerous clinical trials, benfotiamine has demonstrated impressive benefits. In one study, patients with diabetic neuropathy who took 600 mg of benfotiamine daily for 6 weeks experienced marked relief from nerve pain, burning sensations, and numbness. In another trial, it improved nerve conduction speed, essentially helping nerves talk to the brain more quickly and efficiently. Some participants began noticing improvements within just 2 weeks. Longer studies lasting 3 to 6 months revealed even more exciting outcomes. Better blood flow in the hands and feet, faster nerve responses to touch and temperature, and reduced progression of neuropathy. For anyone managing diabetes, these changes are not just about comfort. They're about preserving independence and quality of life. Compared to regular thiamine, benfotiamine is absorbed far more effectively. Standard thiamine often struggles to reach therapeutic levels in the bloodstream and nervous tissue. But benfotiamine can raise blood B1 levels by 5 to 25 times more, making it a far superior option for nerve protection. Typical dosages range from 300 to 600 mg per day, often divided into 2 doses with meals. The supplement builds up gradually in the body, so while it isn't an instant fix, consistent use over several weeks or months can yield profound, lasting benefits. Importantly, it is safe for long-term use. Clinical trials have tested doses exceeding 1,000 Diabetic daily, with no serious side effects reported. Mild stomach upset or dizziness may occur in rare cases, but overall, Benfotiamine is exceptionally well tolerated. For those taking a metformin, a cornerstone diabetes medication, Benfotiamine may be especially valuable. Metformin can gradually lower both B1 and B12 levels, increasing the risk of nerve damage over time. Supplementing with Benfotiamine provides a simple, effective counterbalance. And when combined with alpha-lipoic acid, a potent antioxidant that repairs damaged nerves and enhances insulin sensitivity, the synergy is even stronger. This powerful duo addresses multiple layers of diabetes-related damage and is widely used across Europe, particularly in Germany, as a standard therapy for diabetic neuropathy. This content is essential to be universal in the nursing home and the clinic, where maintaining nerve health is key to preserving mobility and vitality. If you're considering trying Benfotiamine, look for reputable brands that clearly list their dosages, typically 150 ml or 300 ml per capsule. Trusted names include Doctor's Best, Life Extension, and Integrative Therapeutics. Take it consistently, give it time, and remember, while it won't erase nerve damage overnight, it can protect, heal, and restore your body from within. Over the weeks and months ahead, you may just feel the difference in lighter steps, steadier hands, and a renewed sense of well-being. 2. Methylcobalamin, the vital nerve protector your body may be silently craving. Have you ever noticed a strange tingling in your feet, or a sudden wave of fatigue that no amount of rest seems to fix? Or perhaps you found it harder to stay sharp, to remember little things, or to maintain your balance? Many people assume these subtle changes are just part of getting older or living with diabetes. But what if, beneath the surface, your body was quietly crying out for one essential nutrient, one that could restore nerve function, sharpen the mind, and lift your energy? For many with diabetes, methylcobalamin, the natural and active form of vitamin B12, may be the missing key. Unlike the synthetic cyanocobalamin form that the body must laboriously convert, methylcobalamin is ready to use the moment it enters your system. No extra steps required. This is especially crucial for those with diabetes or genetic conditions like MTHFR mutations, which impair the body's ability to process standard B12 effectively. When vitamin B12 levels drop, the consequences ripple across your body. Nerve fibers deteriorate, memory weakens, energy plummets, and mood may darken. This depletion is particularly common in those taking metformin, a widely used diabetes drug that subtly hinders B12 absorption over time. Without realizing it, many people on metformin slowly slip into a B12 deficiency, setting the stage for peripheral neuropathy, the burning, numbness, and sharp pain in hands and feet that so many diabetics know all too well. But there is hope. Methylcobalamin directly nourishes and repairs the myelin sheath, the vital protective layer that insulates nerves and allows electrical signals to travel smoothly. When this sheath erodes, nerve signals falter, leading to discomfort, weakness, and imbalance. By helping to rebuild this protective covering, methylcobalamin restores nerve function and reduces painful symptoms. Multiple studies have shown remarkable benefits. In one, patients with diabetic neuropathy who took 500 to 1,500 micrograms daily experienced less pain, improved sensation, and faster nerve conduction. The nerves literally worked better and faster. Another study found that 1,500 micrograms daily for 4 months enhanced balance and walking ability, while also improving sensitivity to light touch, clear signs of healing nerves. Yet the benefits of methylcobalamin extend beyond the nervous system. It supports red blood cell formation, preventing the fatigue and weakness that accompany anemia. It also plays a key role in lowering homocysteine, a harmful chemical that damages blood vessels and raises cardiovascular risk. For people with diabetes, whose blood vessels are already stressed by high glucose, this vascular protection is invaluable. Methylcobalamin is also uniquely well retained in the body. It stores in the liver and is released as needed, providing longer-lasting benefits than cyanocobalamin. It is typically taken in doses ranging from 1,000 to 5,000 micrograms per day, often as sublingual lozenges that dissolve under the tongue for superior absorption, ideal for those with compromised digestion. In cases of severe deficiency, doctors may recommend intramuscular injections, rapidly replenishing depleted stores. Safety is another strength of methylcobalamin. Being water-soluble, any excess is simply flushed out in the urine. A pinkish tint after high doses is harmless and temporary. Side effects are rare and usually mild, such as slight restlessness when starting supplementation, which typically resolves on its own. For optimal effect, methylcobalamin is often combined with L-Methylfolate and P5P, active vitamin B6, forming a powerful trio known as methylation vitamins. Together, they support not only nerve health, but also cognitive function, cardiovascular protection, and energy metabolism. This content is essential to be universal in the nursing home and the clinic, where preserving nerve health, mobility, and mental clarity is crucial for maintaining independence and quality of life. When choosing a supplement, look for reputable brands such as Jarrow Formulas, Now Foods, Solgar, or Pure Encapsulations, and verify that the label specifies methylcobalamin rather than generic vitamin B12. If you or someone you care for has diabetes, experiences numbness or tingling in the feet, or is taking metformin, it's wise to have B12 levels checked. If they are low, or even at the lower edge of normal, daily supplementation with methylcobalamin can be a simple, safe, and profoundly beneficial step. Over time, this small act of nourishment can help protect nerves, restore vitality, and safeguard the body against the creeping complications of diabetes. 3. Pyridoxal 5-phosphate, P5P. The unsung vitamin that rebuilds nerves, restores calm, and shields against diabetes damage. Have you ever wondered why some days your hands feel strangely numb? Or why an unexplained burning sensation creeps into your feet? Perhaps sleep seems more restless, moods shift unpredictably, or your energy dips no matter how well you manage your blood sugar. What if these subtle signals were your body's quiet plea for one essential nutrient? One that too often gets overlooked, yet plays a vital role in nerve health, mood, and even blood sugar balance? For many, especially those living with diabetes, the missing piece is pyridoxal 5-phosphate, or P5P, the active, ready-to-use form of vitamin B6. Unlike ordinary pyridoxine, which must undergo conversion in the liver, P5P bypasses this bottleneck, entering your bloodstream in its most potent form. This matters greatly because, in diabetes, aging, liver stress, or kidney problems, this conversion often falters. So even if you're taking regular B6, it may not be doing enough. When you supply the body with P5P directly, it goes straight to work, fueling more than 100 enzyme reactions critical to life. For nerves, P5P is indispensable. It helps produce myelin, the protective sheath that insulates nerve fibers, like the coating on electrical wires. Without healthy myelin, nerve signals weaken or become scrambled, resulting in the tingling, numbness, burning, or sharp pains so common in diabetic neuropathy. Yet P5P's benefits go far beyond the nerves alone. It is a key player in the creation of neurotransmitters, chemical messengers like serotonin for mood and calm, dopamine for motivation and pleasure, GABA for relaxation, and norepinephrine for alertness and balanced blood pressure. When P5P is lacking, the brain struggles to produce these vital compounds, leading to fatigue, anxiety, sleep disturbances, or mood swings. Another of P5P's silent but critical roles lies in managing homocysteine, a toxic byproduct of protein metabolism. Left unchecked, high homocysteine damages blood vessels, accelerates nerve degeneration, and raises the risk of blood clots and cardiovascular disease, especially dangerous in diabetes. P5P teams up with methylcobalamin, B12, and L-Methylfolate, B9, to keep homocysteine in check, supporting vascular and nerve health. This content is essential to be universal in the nursing home and the clinic, where preventing vascular complications and preserving nerve function are paramount to maintaining quality of life. Interestingly, diabetes itself tends to lower P5P levels. High blood sugar impairs the enzymes needed to activate regular B6, while kidney dysfunction, a common complication, can cause excessive loss of B6 in urine. Studies even suggest that low B6 levels contribute to insulin resistance, further worsening blood sugar control. Clinical research offers promising insights. In cases of carpal tunnel syndrome, which diabetics are prone to due to tissue glycation and nerve compression, supplementation with 100-200 milliliters of P5P daily has been shown to reduce pain, improve grip strength, and enhance nerve function. Though this condition affects the wrists, the principle applies throughout the body. Diabetics often face similar nerve compression issues in the ankles and feet. For most, a typical P5P dosage ranges from 25 to 50 milligrams daily. In cases of greater need, neuropathy, deficiency, or ongoing nerve symptoms, 100 milligrams daily, sometimes split into 2 doses with food, is well tolerated and effective. Crucially, P5P is safer than high doses of pyridoxal, which at excessive levels can ironically cause neuropathy. P5P, being the active form, is efficiently used and cleared by the body, minimizing this risk. Quality matters when choosing a P5P supplement. Look for brands like Thorne, Seeking Health, and Pure Encapsulations, and always ensure the label clearly states pyridoxal 5-phosphate, not just generic vitamin B6. Many high-quality formulations combine P5P with methyl B12 and L-Methylfolate, synergistically supporting the methylation cycle, a critical system for nerve repair, detoxification, and energy production. Some blends also include magnesium, which enhances nerve relaxation and complements P5P's calming effects. For those with diabetes who experience tingling, burning, or numbness, especially in the extremities, or who awaken with tight or numb hands, adding P5P to their daily routine can make a profound difference. Combined with methylcobalamin and L-Methylfolate, it helps fill common nutritional gaps caused by diabetes and medications like metformin, while supporting both nerve and energy health. Though not an instant cure, with consistent use, P5P gently rebuilds the body's inner resilience. Over time, This often overlooked nutrient can help restore clarity, ease discomfort, and support the vibrant flow of life through every nerve and vessel. 4. L-Methylfolate, the silent repair agent that nourishes nerves, calms the mind, and shields against diabetic damage. Have you ever sensed that beneath the surface, beneath the blood sugar readings and daily medications, your body was still yearning for something deeper to restore balance? Maybe it's the stubborn nerve pain that lingers, the fatigue that shadows your day, or the restless mind that won't find peace at night. What if these symptoms were quietly linked to a single, overlooked nutrient? One that powers some of the body's most vital repair and protection systems. For those living with diabetes, or for anyone struggling with nerve issues, mood swings, or blood sugar imbalances, L-Methylfolate may be the key they've unknowingly missed. Unlike ordinary folic acid, which must undergo several enzymatic changes to become usable, L-Methylfolate is the active, bioavailable form of vitamin B9. It bypasses genetic roadblocks like MTHFR mutations, common in many people with diabetes, and enters the bloodstream ready to work. And its work is profound. One of L-Methylfolate's most critical tasks is reducing homocysteine, a toxic byproduct that silently damages blood vessels, nerves, and even the brain. Elevated homocysteine is strongly linked to heart disease, stroke, cognitive decline, and accelerated nerve damage, especially in diabetes, where blood vessels and nerves are already under siege from high glucose levels. L-Methylfolate partners with Methylcobalamin, B12, and P5P, B6, in the methylation cycle, a core cellular process that detoxifies homocysteine and protects the body from its harmful effects. This content is essential to be universal in the nursing home and the clinic, where controlling vascular risk and preserving cognitive and nerve function are central to long-term quality of life. But L-Methylfolate's benefits don't stop there. It is a master regulator of neurotransmitter production, helping the brain create serotonin, dopamine, and norepinephrine, chemicals that shape mood, energy, focus, and restful sleep. When L-Methylfolate is low, neurotransmitter synthesis falters, leading to depression, anxiety, poor memory, and mental fatigue, symptoms commonly seen in both diabetes and aging. Supplementation often helps restore mental clarity and emotional resilience. On a cellular level, L-Methylfolate drives DNA repair and new cell formation, vital for regenerating damaged tissues, including delicate nerve fibers affected by diabetic neuropathy. By supporting nerve repair, L-Methylfolate helps alleviate the burning, tingling, and numbness that haunt many with diabetes. In fact, multiple studies have shown that combining L-Methylfolate, Methylcobalamin, and P5P significantly reduces nerve pain and improves nerve function in diabetic neuropathy patients, helping restore sensation and mobility. Blood sugar management also ties back to folate. People with low folate levels often exhibit greater insulin resistance, making blood sugar control more difficult. Supplementing with L-Methylfolate supports healthier glucose metabolism, offering yet another layer of protection against diabetes progression. For most, effective dosages range from 400 to 1,000 micrograms daily, though those with deficiencies or genetic polymorphisms may benefit from higher doses. Taken with food, L-Methylfolate is generally very safe. Mild side effects like bloating or stomach upset are rare and typically resolve with proper dosing. Importantly, L-Methylfolate is far superior to cheap synthetic folic acid, particularly for those with conversion impairments, so it is vital to check labels carefully. Many high-quality B-complex supplements now include L-Methylfolate, alongside methylcobalamin and P5P, a combination that supports not just nerve and vascular health, but also energy, detoxification, and overall well-being. Trusted brands such as Thorne, Pure Encapsulations, and Seeking Health offer premium formulations. For individuals with diabetes, especially those experiencing nerve pain, fatigue, mood changes, or taking metformin, adding L-methylfolate to their daily regimen can provide powerful support. By calming inflammation, promoting nerve repair, optimizing neurotransmitters, and improving insulin sensitivity, this remarkable nutrient helps restore the body's inner harmony, quietly, steadily, from the inside out. It may not be the first supplement doctors mention, but over time, L-methylfolate can become a foundational pillar of nerve health, vascular protection, and emotional resilience, helping those with diabetes reclaim vitality and quality of life with each passing day. I hope you learned something new about the vitamins that can support your health with diabetes. If you found this helpful, don't forget to like, comment, and subscribe for more tips on living your best, healthiest life. And if you have any questions or want to share your own experiences, drop a comment below. I'd love to hear from you.